Hi, I'm Bob Kiningham in the Department of Family Medicine at the University of Michigan, and I'm here to talk about our upcoming course in sports medicine for the primary care physician on October 19th. It's part of the fall update in family medicine, which is on October 20th to 21st. Musculoskeletal problems are a big part of primary care. Approximately 20% of visits to primary care clinics are musculoskeletal problems, second only to URIs in frequency. In fact, 1 in 2 American adults have a musculoskeletal condition that requires medical care. The traditional approach to musculoskeletal problems are to treat pain and inflammation with medications or modalities and to modify activity either by resting or changing what you do. What I want to teach in our course and what my colleagues are going to teach will go beyond that. We want to encourage and facilitate safe physical activity. That's what we think the job of the sports medicine physician is. And that requires more than just treating pain. We consider sports medicine very broadly, and it should be a part of all family medicine or primary care practices. Because the scope of sports medicine includes patients who are physically active, patients who want to become physically active, or patients who should become physically active, and that's just about everybody. So it really includes all of us. And our job as physicians is to get people to be physically active, either people who want to continue to be physically active or people who want to become physically active or encourage them. And part of that is treating injuries, part of that is treating medical problems that may interfere with their activity. George Sheehan was a famous author who was part of the running craze, commented that everyone's an athlete. The only difference is that some of us are training and some of us are not. So we want to bring out that inner athlete in everybody for good health and also to allow them to do the things that they want to do. So as you think about musculoskeletal problems, especially the chronic ones that primary care doctors tend to see, we think we have a couple different approaches we can take. We can change or avoid the job or activity, or we can change the patient so they can do the job or activity that they want to do or that they should do. The idea of not doing an activity to avoid what hurts is fine if you can avoid it. But much of what we see are occupational problems or taking care of your child or just being physically active. We don't want to avoid that. We want to allow people to be able to do that. And just resting or giving medication doesn't make you able to do the activity. It's actually a way to avoid it. And when you're done with resting or being active, you haven't changed the original condition that caused the problem in the first place. So if you think about the most common musculoskeletal problems seen in primary care, these are the 3 most common. Weight-bearing osteoarthritis of hip and knee, low back pain of the upper back, we're seeing more and more of the upper back and neck as well as low back pain, and tendinopathies. We used to call these tendinitises, but we realized that these conditions aren't inflammatory, but rather they're degenerative. And common ones are in the shoulder with a rotator cuff and lateral medial epicondylitis. Now the treatment of these isn't just to rest. You can rest to avoid the pain, but what we really need to do is to get stronger and more neuromuscularly in control of your joints to allow you to do these activities without hurting. When I was a resident, the treatment of low back pain was to put people in bed with their hips up. That worked as long as they were in bed, but the problem is people want to get up. And when they get up, you haven't changed anything by putting them to bed. And they hurt themselves again, and that's why back pain becomes recurrent or chronic. And it's the same with these other problems. If you have a woman who's taking care of her child and she says, my back hurts when I lift my child, or I can't feed my child because my elbow hurts, you can't tell her to stop feeding her child and rest for a while. You have to allow her body to do the job that she needs to do. So this is what I call a sports medicine approach to these problems. You're changing their bodies to do the activity that they want or should do. So as you approach these problems, and as we'll try to teach you in our course, you have to think of how can I change their body to do the things that they want to do. And part of that is therapy, part of that can be modalities and things, but mostly it is teaching them what they can do to get strong enough and neuromuscularly intact enough to do these activities. So hopefully that will give you an idea about what the emphasis of our single-day course is. It's part of the longer series from October 19th to October 21st in Ann Arbor. I hope you'll join us there.